Thank you, Jim, and it is indeed an honor for me to be here. I must say, though, at the initiation, I've attended this august club a couple of times as a guest, and frankly, I always had an image of this club as very erudite and very sophisticated. And with that previous presentation with Leland, you belied all of that assumption that I had about this group. Jim was the chair of the search committee that when I was asked to come to Oklahoma in 1987. And it is true that when the search committee had selected to offer me the job, I did point out at the time that I was Catholic and a graduate of the University of Texas. And Jim's response was, well, we can take care of the Catholic part. The others are much more difficult. I am not going to talk about Integris Health. I'd love to, but I think that would not be appropriate here. Suffice it to say, I'm very proud of our organization. We are the largest provider of health services in Oklahoma. We're the second largest private employer in Oklahoma. There are 10,000 of us that draw a paycheck from Integris. We're very proud of the organization and some of the accomplishments that Jim mentioned. On the other hand, I'd really like to focus a little bit on health policy and what's happening at the national level and some of the discussion that's going on. I think we might find that somewhat interesting. And let me say at the outset, what I'm about to say is simply my opinion. It's not worth any more than that. It's one person's observation. I've been a chief executive officer of an American hospital and American healthcare system for over 35 years. So I'm bringing that prejudice to my observations. I'm a little nervous because I know there are a number of distinguished physicians in the audience, Matthew Britt from Baptist, Dr. Smith, and they're very erudite and very sophisticated in this kind of, but I'm going to tell you what I think about the subject. Like many of you, I watched the debate last week with some interest. And I watched both candidates talk about their healthcare platform. And as they extolled their particular point of view, I had this overwhelming sensation. And it reminded me of the quote from H.L. Mencken, the acerbic writer from the 20s. And Mencken said, "For every complex problem, there is a neat and easy solution, and it's wrong." Frankly, and Mary, with your indulgence, I think neither candidate have a clue what they're talking about. And I'll give you just two examples why I don't think they focused on the complexity of the problem. From the Republican side, Senator McCain, of course, talks a lot about, well, we don't want a national health policy, we want freedom of choice and those kinds of things. I don't know what anybody thinks Medicare is. Medicare, by definition, is national health insurance. The government tells you what they're going to pay you, when they're going to pay you, how they're going to pay you, and sets all the rules. And it's a single-payer system. It's just for those over 65. It, by definition, is a national health policy. And it's, frankly, one of the most popular programs in the United States. So popular that not one politician will touch it. And we all know that if we don't do something about it, it's going to cause some severe economic disruption in this country. On the other hand, Senator Obama said in the debate that when we go to a coverage for all, one of the ways we're going to pay for it is improvements in our information technology systems. That, at best, is naive. And it indicates a clear lack of understanding of how complex the problem is and the impact that information technology, which is badly needed, will have on the overall problem. So frankly, I don't give a lot of store for either of the candidates in their approach. And let me tell you why. It seems to me that what they have failed to do is to appreciate the uniqueness of the American healthcare system. And it is unique. It's like none other in the world. And I'm going to give you several reasons why I think it's unique and why I think our politicians and our policymakers to date have failed to appreciate that complexity. First off is this whole conversation about health insurance. Health insurance. We talk about insurance as if it were insurance. It is not insurance. What is insurance? Well, I'm not sophisticated in this, but what I think insurance is you take a little bit of money from the many to pay for the significant losses of the few. That's clearly not health insurance. What we have in this country is a transfer of payments. We pay an organization, an insurance company, premiums to collect, and they pass along in terms of their benefits and their payments to the providers. It's a transfer of money. It's not an insurance concept as we know it. The second thing that I think we need to be kind of aware of, and I'll describe for you and use an analogy of how our health insurance system in the United States works. I have 2 daughters, lovely women, who love to shop. If I gave to one of my daughters my credit card, and I said, "Dear, I want you to take this to the mall, and I want you to get anything you want, anything you think you need, you buy with my credit card." And my daughter goes to the mall, she hands my credit card to the salesperson and says, "Pick out for me anything you think I need." What do you think happens to my cost as the owner of that credit card? That's our healthcare system. A complete disconnection between those receiving the service, those paying for the service, and those requesting the service. And what do we get? We get extremely high cost. So that's our health insurance system. And we have to understand the way it works. It's not like your car insurance. It's not like your homeowner's insurance. When you buy homeowner's insurance, you do not expect the insurance company to pay you when somebody throws a ball through your window. However, every time we go to the doctor, we expect our insurance company to pay for it. That's not insurance by definition. Secondly is our tort system. Our tort system is unique in this country. And whether or not you think it's overdone or not overdone, or whether we need tort reform, the fact of the matter is that when every doctor views every patient as a potential litigant, the accelerator on the cost of health care is enormous. And we simply have to realize that. Thirdly, we have in this country a history of entrepreneurship in healthcare that is not found anywhere else in the world. The healthcare economy is a $2 trillion economy. It is 17% of the gross national product. And when I started, it was 6% of the gross national product 35 years ago. Now it's 17%, which means it's crowded out some other, obviously, highly desirable, highly needed services. But the entrepreneurship at the physician level, at the hospital level, and pharmaceuticals and device manufacturers, insurance companies, the vested interest in the system are so enormous and so powerful that it will make any change extremely difficult to effect. I'm reading a book now about Harry Truman. 1948, he proposed for the first time national health insurance. We're no closer to it today than we were in 1948. When I wrote my master's thesis in 1963, I just reread it, 73. I predicted within a year we'd have a national health policy, and you can tell how good a predictor I was. The system, frankly, defies change because of the tremendous amount of money and the tremendous amount of vested interest. We have, fourthly, a mixture of not-for-profit and for-profit that is also not found anywhere else in the world. And that is, I think, a strength of the system, but it also is a challenge of the system. It is two different philosophies about how to operate in healthcare, and frankly presents some real challenges to us. Fifth is this issue of high technology. We are very, very blessed in this country to have technology readily available across a whole spectrum of geography. And that's not found anywhere else in the world. And in some respects, that's a blessing, but it comes at a very high cost. If you have a heart attack today, you can be on the operating table this afternoon. If you need an MRI this afternoon, we can get it for you in an hour. You've often heard it said we have more MRIs, more CAT scanners in Oklahoma than they have in the whole country of Canada. Well, frankly, that's true. And any system, if you want to look at controlling healthcare costs, you have to have some resource to be able to control healthcare costs. And the way Canada does it is very simple. They control it by means of the queue. You get in line. They control it by the limitations on high technology. The fact is that we have this abundance of high technology, which makes healthcare so readily accessible for each of you, frankly, is a very expensive system to maintain. And in hospital after hospital, we duplicate expensive technology with no mind as to what the overall impact of that duplication is. And that's because that's the way our system works. Physicians are incentivized by how much they do. Hospitals are incentivized by how much they do. The more we do, the more we get paid. Frankly, if you set out 30 years ago to devise a system absolutely designed to give you high cost, it'd be the system we have today. So my point is only this: as good as the system is, as high tech as it is, as wonderful it is, it comes at a very high price. And if you fail to appreciate that high price in terms of trying to develop health policy, I think it's going to be very frustrating. You know, the fact of the matter is, healthcare, in my judgment, is not market-driven. There's some to say that we want to reduce it to a market-driven element. If we just put all the economic incentives at the patient level, they'll go to the computer, they'll look up their hospital, they'll look up their doctor, and they'll make very wise economic choices on how they pursue their care. I've never believed that. There's nothing in my 35 years that tells me that that's actually going to be true. Two reasons. Number one, at the end of the day, when your doctor says, I want you to do X, here's what you're going to say. Doctor, if it were your husband, your father, your mother, your brother, what would you do? And the doctor says, this is what I do, and you say, yes, sir, and that's what you do. That's the way our system works. From an economic standpoint, you put 4 gasoline stations on an intersection, you drive down cost. You put 4 MRIs on an intersection, you're going to drive up cost and you're going to drive up utilization. That's the way the system. We do not work on a market-driven basis. Never have. And I'm not sure what's going to change that to make it market-driven. Fifth is our morality. And this is a very significant point for us. We have a very hard time coming to grips with the limitations of our own abilities. We do catheterizations for people 85 years old. They would never do a heart cath in other countries for people 85 years old. It just wouldn't be done. My father-in-law had a complete prostatectomy at 90. That would never be considered in any other country. That is, we have the capability of doing it. We get paid by what we do. Our philosophy, our mindset, is to do everything possible. And frankly, our own mindset about our loved ones and ourselves is, whatever it costs, I want it. Now that's not bad, but we've got to understand that's a tremendous accelerator on cost. You've all heard the old saying, and it's absolutely true, about 30% of every dollar that's going to be spent on you in your lifetime is going to be spent in the last year of life. Probably on life support in an ICU and in a very expensive hospital room. That's not done in other countries. They don't have either the tort system or the morality or the impetus to treat patients like we do. That's an accelerator on our healthcare costs. Next, we've been amazingly successful. Our physicians here, like some of the ones I mentioned, and our research have given us wonderful marvels. 1975, you get kidney failure. What are your choices? Well, your choices are to die. Today, you get kidney failure, you have lots of choices. And you'll probably survive if well treated. What we're doing, in essence, is, and excuse this comment, because of our successes, we are keeping all of us alive to die of something more expensive later on in life. And then finally is this whole business of the uninsured. It is a huge problem in this country. I'm not sure you realize in the last 5 years we've gone from a fourth of our population uninsured to a third. And it is growing extremely rapidly. And we are in a death spiral on the uninsured. And how do we deal with that? Well, we deal with it cost shifting. So we shift cost to the insured patient for all those that show up at our doorstep with no insurance, and we are morally and legally required to see them and treat them. That cost is then passed along to the insured patient, your employees. As your premiums go up, it becomes harder and harder for you to provide health insurance for them. as more and more employers begin to question insurance, or they give to their employees extremely high deductibles, what that does, of course, is throw more people into the uninsured role or into the semi-insured role. Interesting fact, the highest percentage of our bad debt in hospitals today is people with insurance who have high deductibles that they cannot satisfy, and they have not saved for. So the uninsured is a very expensive and very difficult problem. So, what are my conclusions out of all that? Well, as I said, I think we've underestimated the complexity of the problem. And unless and until we appreciate the complexity, I think we're going to be reduced to sound bites and political wisdoms, that are reduced to kind of easy solutions. If it were me, what I think is missing from the conversation is two things, and probably much more, but at least these two. Number one, we have to do something about the variation in this country. I'm not sure you realize there is as much as 600 to 700% variation in how patients are treated across this country. If you do nothing else and look at what Medicare pays for in populations with basically the same demographics and how those patients are treated, you see tremendous variation and unexplainable variation. And those of you that are familiar with systems thinking, you clearly understand that variation is a symbol of poor quality. And as a medical system, we cannot justify the variation that's in this system. I think we've got to dedicate ourselves in this country to a real focus on evidence-based medicine. We're beginning to do that. But we've got to ask the best and the brightest of our physicians to help us step through a process where every patient is subject to a review of how they're being treated based on the best evidence available. We've got to reduce variation. This doesn't imply that we don't leave lots of room for the physicians to individualize their treatment plans based on patient differences. But until we reduce variation in this country and begin to eliminate it, we're never, ever going to solve our healthcare problem. And then finally, and for me, this is perhaps the most important element, we really got to figure out what it is we owe each American. And see, what we're talking about, Democrat, Republican, we're talking about money. We're talking about moving the money, or how we insure more people. We've never stopped to ask ourselves, what is it that we're going to insure? And we have the possibility of throwing a lot more money at a problem we hadn't figured out the basic answer yet. Now, this is not only a legal problem, it's a huge moral problem. But let me give you an analogy. Our public school system. We know with a great degree of finiteness what it is we owe each child in this country. Every child, regardless of race, color, economic origin, status, each child in this country gets a kindergarten through 12th grade education. Period. End of discussion. That's national policy. Now, we leave it up to local school boards to determine whether we're going to have a debate club, and what color the football uniforms are, and what we're going to pay teachers. That's reflective of our elected officials in the school board. So there is some individuality. But we know with great certainty what each child in this United States gets. We haven't come close to trying to figure that out in healthcare. Much more difficult. But how can we talk about insuring something we haven't defined? What is it that each American gets? At the very core, what does each of us get by virtue of the fact that we're American? I think until and unless we answer that question, as hard as it is, as difficult as it is, as fraught it is with political difficulties, we're going to be very, very frustrated in trying to develop a national health policy. We've got to force ourselves to make those decisions. And just like in the school system, nobody forces you to send your children to private school. You have that option if you have the economic wherewithal to do so. I think we have to take kind of the same philosophy. We got to figure out what it is we owe each American. If people have the resources to buy more than that, well, that's fine. But at the very core, what is it that we're going to insure? So, that's my thoughts about where we're going in this country. I came here to this luncheon from a meeting at the state capitol, where we were going through what a number of states had done to address the problem of the uninsured and health policy. I must tell you, I was very impressed. In this state, for instance, with the Insure Oklahoma, that's a remarkable program that's done a lot of good and has the opportunity to do a whole lot more good in terms of getting at this problem of the uninsured. That's where the energy is. That's where the vitality is. That's where the ingenuity is at the state level. And we went through state after state after state in terms of how they were beginning to approach the problem. So as you watch the debates and as you think about health policy, please keep in mind the complexity of what it is we're trying to do. Don't be fooled into easy answers to tough problems. And I think all of us owe it to ourselves, our children, and our communities to ask the tough questions. And speaking of tough questions, I'll be glad to take any if anybody has any. I have a few moments, I'm told. Yes, sir.
Do you have a model somewhere in the world that you like best if you're trying to move America forward?
No. There are unique problems everywhere. I had a sister-in-law who spent a number of years in Canada. She loved the Canadian system. And, we look at it, we go, oh my God, it's a national health insurance. She thought it was great until she had major surgery. And then she had to come south to have her major surgery. So I think there are some countries that have done a better job at it than we are, particularly in terms of the uninsured. But I don't think there's a national solution that takes into consideration the uniqueness of our environment. So we have to come up with a truly unique American solution.